Vodafone cares about you and your health. HealthFest has gone from strength to strength. It gives hope to many Ghanaians across the nation with its free medical assessment and care. The Medical Call Center 255 continues to empower Ghanaians with our unique phone-in medical consultancy. But it all started here on your TV screen with the award-winning program Healthline. This week on Vodafone Healthline, our doctors talk about truth serum. In the field, we catch up with Comfort a year after her encounter with Vodafone.
Hello to you all and welcome to Vodafone Healthline, the show that gives you the knowledge to move forward in life, empowered to make wise health decisions. My name is Bright.
I'm Lorraine.
Hello, my name is Ruth.
Hi, I'm Papane.
Let's see who our health cam has found.
Well, Joshua, stammering or stuttering, as some other people call it, is basically a disorder of fluency of speech. We're all born more or less stammering. Children have to stammer before they learn how to speak properly. And then gradually, as they grow up and develop and their brain functions actually mature, then they learn how to form their words and speak full sentences. If for one reason or the other, this continues into adulthood, then you have an individual who becomes a stutterer. Now, some of the signs you will see with people who stutter in this case are maybe difficulty forming a word, difficulty mentioning a phrase, or probably difficulty even forming a full sentence. Now, what are some of the things that could cause this stammering? It's been seen that if you have somebody in your family who stammers, there's a high chance that you will also stammer, or one other person in your family will stammer. However, also, if you have delayed childhood development, so you know your child is supposed to learn how to speak at a certain age, learn how to form words at a certain age. If this delays, you may think your child is a stammerer. So that's one way to look at it in that case. Also, if there was a medical problem, maybe the person has a stroke or something like that, they might also have difficulty forming their words in that case.
When it comes to stammering, it's associated with a lot of psychosocial problems because some people feel stigmatized, some people end up crawling into their shell, they end up having the anxiety to speak in public. So once we pick up the children before the age of 5 and then they are exposed to the right therapist, and bear in mind this is a multimodal, so aside the speech therapist, we also have some sort of psychological, retraining to boost their confidence. You can do it, don't be scared, don't be anxious. We have the two types, the one in the early onset, and then we have the acquired stammering. Maybe you had a stroke or you had certain neurological impairments. As humans, we are adaptable species, so we can be trained to do anything. So if you've lost any function at all, don't get so disheartened. With rehabilitation and the right avenues, you can be trained and relearn everything that you've probably lost the ability to do.
It's also been researched that there are differences in the brain structure and function when it comes to stammering, in that in stammering, instead of the speech part of your brain actually being active, you find that the emotional part or the motor part is actually active. Okay, Joshua, I hope this helps, but remember, if someone stammers, there's always help for that person.
So we have an SMS, and this is from Benjamin. He's from Somanya. He says, "My brother was involved in an accident and broke his leg. They said he needs an operation to fix the leg. Can't we cure him with herbal medicine? Good old herbal medicine."
That's a popular one, isn't it?
Yeah.
Okay, Benjamin, obviously there have been success stories about herbal medicine being able to sort out people's fractures, but then more often than not, we've encountered more complications as a result of these things because there's so many types of fractures. And for the herbalist, he wouldn't be able to tell whether the bone is displaced, stable, or whether it's actually broken into many places. But in the hospital, there are so many things that can be done to ascertain these things. You can do an x-ray which shows that, okay, two bones are broken, and especially a fracture of your thigh where you have very strong muscles that can pull the bones apart. These kind of fractures are very difficult to fix outside the hospital. So if your brother has any such fracture, probably if it's of his leg and it's near the joint, or it's of his thigh bone and it's probably even near the hip, it's very important that you go to the hospital, have the doctor look into it and actually fix it for you.
Now, Benjamin, the reason why we do all of this and why the doctor will ask you to have an operation is that your bones in your body aren't just inanimate things, they actually live. It's tissue. I want you to take a look at this, okay? This is your thigh bone over here. If we were to cut your thigh bone, you'd actually see a white layer and a red layer. This red layer is actually blood vessels that are going through your bone. When you have a fracture, what happens is that you rip the tissue apart. And like any part of tissue that is ripped apart, let's say if you tear your skin, for instance, your skin has to come back and heal. These blood vessels have to join again for your skin to be functioning normally. It's the same thing with bone. So keep in mind that whenever you have a fracture, you've broken some sort of continuity. So suddenly, if you leave that apart, you're going to have problems with that, with both bones on either side. And they weren't meant to be separate. They were meant to be together so that you could walk or move your arms or stand up or sit correctly. So remember that it's living tissue that you're working with. If you're dealing with somebody who doesn't know this and isn't fully aware how to manage living tissue, and in this case, bony tissue, you could have problems. So I would advise that don't go see a herbalist. You can see a herbalist for other reasons and other things. So go see a specialist, somebody who's trained in managing bones, who will help your brother fix his leg.
Thank you, Benjamin. I hope this helps. iRead shows us what we can do if you know a bit of basic first aid.
Daddy, me I can blow fire. Daddy, look.
No, I'm not a doctor, but with first aid, I can help. First aid for burns. Remove hot or burned clothing. If clothing sticks to skin, cut or tear around it. Hold burned skin under cool running water, not cold water. You can also immerse in cool water until the pain subsides. Protect the burn by covering it with a sterile non-adhesive bandage or clean cloth. Do not apply butter or ointment because these can cause infection. Now see a doctor for help.
Daddy, I'm sorry.
So you see, it's not really rocket science now, is it?
Vodafone, power to you.
My name is Mary Ann and I stay as Painters. I called 255 sometime back in February looking for an alternative medicine to a painkiller I was taking. Because of the condition I was going through, they advised me to keep up with what I was taking. And I think their advice was the best I've ever seen. I'm so grateful for 255. I'm so grateful. Thank you.
Join us on Kids Corner today to learn more about your child's health needs. Today we talk about bedwetting.
Bedwetting is nothing to be very ashamed about because as a child, you don't expect a child to be able to have bladder control. The neurological system or the nervous system which coordinates the release of urine and voiding is not mature enough as children. You have what you call primary bedwetting or primary enuresis, meaning that they have never stopped wetting the bed from childhood till date. And then the secondary one means that at a point they stopped wetting the bed. They had full control of their bladder for at least 6 months, and then suddenly everything went haywire and then they started wetting the bed again.
So there could be different causes of bedwetting, or as we term it, enuresis. For example, the child could have a small bladder, naturally have a smaller bladder than normal. Or they may be unable to identify, be able to detect what a full bladder is. So every now and then they feel the urge to go wee, and maybe they end up doing it at night as well. They could have an infection or some kind of urinary tract infection. That in itself will stimulate some kind of repeated, what we term frequency, a desire to constantly go and urinate. It's also been seen that children who have constipation end up having more episodes of urinating because their body still needs to get rid of some kind of water. something we term sleep apnea. It's been noticed that kids who have sleep apnea or difficulty breathing because of some kind of obstruction in their upper airways also end up having enuresis as well.
To help your doctor to be able to help your child, most of the time, some parents keep a track record of the pattern of the bedwetting. Is it an everyday thing, or is it a once in a day accident, or it's every other day, the frequency? And then you also want to find out if it's usually linked with activity. You know, some children are so excited playing, they forget they have to go and urinate. They don't want to leave the toy, so they sit there until you realize that the urine is coming.
So parents, here are some tips that you can actually put to practice. For instance, before your child goes to sleep, ensure that your child urinates. And avoid giving your child too much water. In actual fact, reduce the amount of water your child takes in the evenings. And there's also caffeinated drinks and food which actually increase your child's urination, especially the fizzy drinks. So this is something that you should actually try and reduce. You must also encourage your child to use the toilet a lot of times during the day, so that at least in the evening, the amount of urine that the child will likely pass would actually be reduced. And obviously, with a little bit of sensitivity to the child's feeling and being there to reassure the child, support the child, can actually help the child look forward to much drier nights ahead.
So I've noticed that another helpful tool that as parents we can use is to, as opposed to resorting to negative reinforcement by jeering at them whenever they pee, why don't you rather reward dry days? So we call that positive reinforcement. So on a day, you didn't wet the bed, okay, here's 10 cedis. Every day I promise you they'll come dry for their 10 cedis.
It's sometimes difficult to know the real truth. On Mythbusters, we find out. We take a question from the audience.
Hello doctors, I actually want to find out, is truth serum real?
Truth serum is basically when people say that they're talking about these drugs that alter your mind and make you incapable of lying. When you want to say something, whether it's a truth or not, you want to think about it. Your body sends the signals to your brain, and then your brain starts functioning and says, okay, should I tell them the truth or should I alter the truth? And then you make a conscious decision to say what you want to say. So a lot of the time, people end up attributing these drugs to being capable of making you incapable of lying, but that's not true.
There's no actual truth serum in a bottle that you see a bottle and they've written truth serum. No. So it's not true, but it's just that there are some drugs and some substances such as alcohol that have the ability to disinhibit your ability of filtering what comes out. So there's no such thing as truth serum.
So I'm sure this helps. Thank you for your question.
Thank you, doctors.
The following segment contains material of an adult nature. Viewer discretion is advised.
Sex is sometimes difficult to talk about. We make it easy on Sex Talk.
So we have an SMS. The person doesn't mention their name, but this is what it reads. Before I became sexually active, I used to hear how wonderful it is to be touched in certain places like the breasts. I hardly feel anything when my breasts are touched. Is there something wrong with my body? You see, when it comes to stimulation or pleasure, everybody has their own peculiar pleasure spots. So I think that maybe someone told her that when your breasts are touched, you get so much joy or so much pleasure. But it's highly subjective. It's a perspective thing. So I think that when it comes to what you enjoy as a person, allow yourself to experiment and find out what you want and what makes you happy so that you can relate that to your partner. Don't live off other people's sex lives. And I think that's what happens with a lot of people who either are not sexually active or have little sexual experience and have friends who have a lot of sexual experience. So you end up building certain fantasies based on what they tell you. It's all about knowing yourself and knowing what you want.
So the breasts are not the only key place. I think what you have to do is just explore and find out other places that can actually do the job for you. Healthline returns after this break.
Comfort was featured on Healthline last season when the team discovered her in a dire state. Let's get familiar with her story again, then see how she's doing now.
Comfort be a mapa, Pachamit Kaswa. nkwana mete ho. Be say 5 years ni na mete hwe me nan ne so na mete say ya obi wo mu na me call hospital. Na doctor ne say emu mbuye nti wa mama ntwa history no ma me painkiller ene ointment se me mfanfa so. Ena na eba na ye me ya nso me ntumi na me de kwa abotre clinic kwa chichireye.
Feeling desperate, Comfort went to a number of clinics seeking relief. She met Daniel at one of those clinics.
Nishano ewo adawaka polyclinic wa ewo aba hospital wa be doctors and na ye ya. Ti na omo ka chene se ewo se oba no be ye laos bi no twa extra no mo de hwe na no nti no ewo na doctor ne ka chene se wo hwe we no so we na ye bibia enye na ya ebu bibia e develop of na just say tumor. Obi some question na say I don't know dey ben. So at that time me go international me read about it. I mean say oh ABB. I say one I do pay no. Me pona me because e would do pay no be to kra na activists. Until no I very scared.
Comfort was diagnosed sometime in 2012 as a case of a dense cell tumor on the proximal tibia. The first time she came, the tumor was evacuated, and then we were supposed to put in the bone cement as a temporary measure, and then later on bone chips from the iliac crest, but we didn't find her again. It's been 3 years since she reported here. She was referred to Kolibu Teaching Hospital, but it happened that she didn't honor the referral.
Comfort was so afraid of the surgery, she decided to put up with the pain.
Me nine no, intimi mama nye me hairdressing ejuma, intimi mama nkoye nani, na intimi mpo mama nkwa asori.
Comfort's condition continued to worsen, so she decided to return to the hospital.
And this time, when she came from the x-ray, we could find out that the tumor was eating both knee joints, the proximal tibia and the distal femur. So the only way for her to improve her quality of life was to have a bad knee amputation, so that later on she can have a prosthesis, a lower limb fitted, and then she can work on it.
Doctor say, I just say, you try me nine. I said, I'm meeting me nine so. You who a woman money say me cooperation now, maybe I mean to me survive, and I say be I mean to me and until me nine subim until ne shame who.
To calm her fears, Vodafone took Comfort to the orthopedic training center in Insawam so she could get some counseling.
When most of these patients come in, they are scared to lose their legs because they always think about how the society is going to receive them with a disability. So they will prefer to keep the painful leg, the non-functional leg, because of that. Some of them too, for lack of education, do not know what happens even after the amputation. Are they going to forever remain with crutches? Are they forever going to be dependent on their relatives? After the amputation, she can go about her normal duties at home. She can go back to work. She will have no pain. She will be functional. And that's what matters most than to keep a leg that would eventually kill you. The education really helps. And in addition to that, we counsel them to give them hope. Hope that life can be normal again if they are willing to take that step. When you come here, you see other people. It's a very healthy environment. You share your experiences, then you know that, no, I'm not alone. We have a lot of programs to make them comfortable, right from treatment, individual and group exercises with others. We have the hydrotherapy, playing the pool. We have a whole lot. So when you leave, you fit into the society. So that's what we do to help our patients, and we're achieving great results.
Na me bompa isenya me be me boafo amame. Me boafo obeboa me na metimi akoye operation.
The following scenes contain images that could disturb sensitive viewers. Viewer discretion is advised. Vodafone listened to Comfort and are now giving her the treatment she needs. Comfort is given an epidural anesthetic to numb the pain. She'll be awake throughout the procedure.
The surgery involves the amputation of the lower limb above the knee joint. A stamp is made so that it can be remodeled or modeled by the limb fitting unit. That will give her a prosthesis to work on. Now what is left is for the wound to heal, and we'll hand her over to the physiotherapist. With the lower limb prosthesis given, she'll be able to do some work like hairdressing or tailoring or whatever. At least that will increase or raise her quality of life.
Vodafone would like to thank the St. Joseph Orthopedic Hospital and the Orthopedic Training Center for all they have done for Comfort.
Please join me as I welcome Comfort and her friend Daniel into the studio. Comfort, welcome.
Thank you.
Oh, it's such an amazing story. I want to ask, how are you feeling now?
Good afternoon, Adaroma. It's my cooperation and
How has your life changed from before your operation to now?
Na me to me ya me ho hwe na so me cooperation mo bae me se bibia ya amigina so krampo ya madwuma me nti se baby ya me ya anase baby etwe me anase ya na me wo mu no esen kra me bi me esen kra me bi me sorry krampo na nse ekọ come adwuma so.
Wow. That is so good. That is so good. You're a hairdresser, right? See, how was working with your condition? How was it different from your life now?
Sometimes I was saying, na me de me nan hihye mu na ba na me koy operation ne baaye me fa me nan hye so hye me gina me nan so eye madwuma me nya me adum matimi me ye adwuma e ma me wa apprentice so baako.
Oh, nice. Daniel, do you have anything to add?
Nya me adum ye Vodafone phone no amoye no operation we no. You see, I know, like, I'm so happy because first, actually, every week, you are not framing. Then, I mean, I know, as I have a boom, every week, I mean, I know, it's just frame, like, we talk about other things, human and Yama. In fact, I'm in Japan, I mean, like, I'm so happy, and I want to thank Vodafone for this great work they've done.
What an amazing end to an inspiring story. Vodafone Healthline will be coming your way again next week. Until then, keep smiling and maintain a healthy life. Goodbye.
Vodafone will continue to support this program. If you have been moved by the stories or issues you've seen on Healthline, you can donate 1 Ghana cedi by texting GIVE to 133. Or you can donate by sending your contribution via Vodafone Cash to 835000. Next week on Vodafone Healthline, our doctors talk about anesthetics. In the field, time is running out for Joel, who needs a second operation to save his life.
Vodafone, power to you.